I've got a strong conviction on this because I've looked at this data in detail and managed patients and looked at all the different bits of information coming out. It probably, if we'd had an independent review of the data at the beginning, as in the MHLRA that gets 86% of its funding from pharma, which is a problem, and of course it was a rush. We can understand why it happened. It probably may not have been given to a single human being in the first place because it was going to do more harm than good. Kennedy knows that. People inside HHS know that. People inside the White House know that. I've had conversations with them. And the biggest problem we've got now is, and this is, quoting Marty McCarry, head of the FDA, in America, hundreds of thousands of people have claimed they've been vaccine injured. Historically, I had to do months of research into this and also make a U-turn. I must mention this. It wasn't easy for me to do that.
Dr. Aseem Malhotra, thank you for being with us. Appreciate it. What's the thrust of what you're going to say this weekend at the Reform Conference?
Thank you, Kate. So actually the title of my talk is How to Make Britain Healthy Again.
I wonder where you got that from.
Well, they actually asked me what would you like to discuss or what do you think would be good? And I thought, obviously, considering that I've had a role to play in the the movement in America with Make America Healthy Again, I thought that would be ideal. But also it reflects essentially my advocacy work and research going back probably a good 15 years. So I do have a lot of experience, I think, in this area, certainly in terms of how do you improve quality care in the NHS, how do you improve public health? These are all my areas of interest.
What is going to make the headlines, do you think?
Wow, I suppose there's lots of different potential headlines. I think that, the theme really, I think the elephant in the room, Kay, that hasn't been addressed is the fact that medical knowledge is under commercial control, but most doctors don't know that. Okay,
explain what you mean, and then we'll dig into that.
So I am someone that is obsessed with two things, which I think is what patients and the public want in their doctors: evidence and ethics. And when I give my lectures, and I'm going to put this slide up, I think it's one of the most interesting, important slides that I've used in my lectures around the world. It's called the evidence-based medicine triad. And it's a very elegant analytical framework for teaching and practicing medicine. And the purpose of that triad is to improve patient outcomes. So relieve suffering, manage risks, and treating illness. And there are three components, which I think is quite easy for people to get their head around. They are individual clinical expertise, as a doctor, your clinical intuition, your knowledge, etc. The best available evidence on whether it's a surgical procedure, whether it's prescribing a drug, whether it's a lifestyle. And last but not least, the most important is taking into consideration individual patient preferences and values. So it doesn't take a rocket scientist to figure out if there's anything wrong with one or several of those components. At best, you're going to get suboptimal outcomes for your patients. And at worst, you're going to do harm.
And I don't think many doctors, physicians are going to disagree with the principle of that, are they?
Not at all. But this is where the issue lies, is when you look at best available evidence, and I cite I would call him the Stephen Hawking of medicine. He's called Professor John Ioannidis at Stanford. The reason I call him Stephen Hawking of medicine, he's the most cited medical researcher in the world. He is an expert in data analysis, scientific integrity. And he published a paper in 2017, which and again, it's something I'm going to bring up in my lecture, called How to Survive the Medical Misinformation Mess. And he makes the point that most medical research is unreliable, not useful for policymakers, and is unhelpful to patients. And he says 20 to 50% of all, I know this is US, but these are relevant to the UK as well, 20 to 50% of all healthcare activity in the United States, they spend over $4 trillion in healthcare per year, brings no benefit to the patient, is wasteful or harmful. Think about that, it's quite a lot. And the reason he says is because most of the research behind clinical decision-making is essentially unreliable, because it is one of the main reasons it's under the control of the drug companies.
Okay, so let's just take your average. Yeah. And this is in America or in the UK or both?
It's all around the world.
Okay.
It's all around the world.
So let's just take a research facility at a university in the UK, and we can probably name several between us. You're saying they are under the influence of Big Pharma?
Yeah, and it's not like a sort of...
Because they're going to dispute that, aren't they?
Yeah, it's not... Well, let me explain how this works. So we take a step back. Let's go a bit more further upstream. When we prescribe drugs in medicine, there are processes that happen. There are publications in medical journals. There are approval by regulators. Okay. Now, those trials that are done are invariably designed by the drug companies. And often these trials, these randomized trials, these sort of high quality level of evidence trials, they involve thousands and thousands of patients, and those trials can go on for several years. And the data on those trials is often tens of thousands of pages. What they do is the drug companies, and this is something that isn't very well known, even before the trial starts on this product they think is going to be beneficial, they're already deciding what their marketing strategy is. So there's already a bias introduced. They then design the trial, and they design the trial in a way. So there's so many ways of biasing the results, of a way that it's going to likely give them the best results. And sometimes that can mean that they choose certain participants in the trial that are less likely to get side effects. Then what happens is the summary results are then given to the regulators, who then make a decision on whether or not to approve the drug. And so that means most of the time, they do not look at all of the data. They just trust what they're given by the drug companies. Now, the drug companies, their legal obligation is to produce profit for shareholders. They don't actually have a legal obligation to give you the best treatment. But can
I just step in and just ask, aren't those many of those drug companies informed? Don't they use the basis of the product that they're about to produce? The very start of that, the very embryo of that, comes from medical research conducted by independent research facilities, university-based research facilities. And what the drug company does is it takes a technology, maybe it buys a technology, and then it creates a drug, and it obviously then is interested in marketing that drug to sell to the NHS. And it's a whole minefield in the United States, because obviously it is heavily commercialised in the United States, and that's where it gets difficult. But isn't the basis of that drug, the science behind it, doesn't that, at its very core, the very understanding of how that drug works, and we can take vaccines as the example, if we like, doesn't that come from reputable scientists?
That's a very good
educational establishments, centres of learning.
That's a very good question, and that is the conventional perception and wisdom. And yes, that is true, but you don't know actually whether your product or what you've discovered is actually going to work until you put it through a clinical trial. So on that point, Kay, I think there is a misconception out there, first of all, that medicine is an exact science, and it's not. It's an applied science. It's a science of human beings. Social science is constantly evolving. There are many discoveries that have happened historically where you've thought, of course, this is going to work. You put it through the trial. Let's say, for example, you discover a biomarker in the body associated with disease, okay? You found this biomarker and you think, okay, we're going to develop a drug to lower that biomarker, influence it, and then protect people from, say, heart attacks or stroke or whatever. Let's say we can take an example of statins. Actually, that's a good one. So let's look at statins, one of the most prescribed drugs in the history of the world. And when you look at the issue about statins, and this is not just my view, the BMJ have been involved in a campaign for years on this to try and get access to the raw data. What that means is the raw data from those trials has never been independently verified. The scientists at Oxford who conducted the analysis also have got a bias. Now, I'm not saying that they've deliberately done anything, but there is a bias because they've also received lots of money, hundreds of millions from drug companies to their institution. So it begins, and then there are discrepancies between what's published, and then other scientists come out and say, hold on a minute, or real world doctors say, you've published in The Lancet saying that the side effects of statins are less than 1% in terms of, say, muscle aches. Nothing life-threatening, let's be honest here, because I manage lots of patients who've taken statins. And then in the real world, suddenly people start saying, hold on a minute, doc's saying, I'm diagnosing about 20%. Like, what's going on? In fact, that's the reason I even started on this journey. But the point I'm making is, you've got a product that might have some scientific validity, you've got to test that hypothesis. And when the testing is done, the drug companies are already there thinking, hold on a minute, we were going to put all this money into the trial, we need to make money out of this. So they are already biased towards, and what happens at the result, it doesn't mean the drug doesn't work, but what happens at the result is that the safety and the benefits are invariably grossly exaggerated.
So you would question the journey from the science at the start to the chemist, effectively, of those drugs. And I want to return back to what you're going to say at conference, because the kind of overarching interpretation I have of that is you want to open people's eyes to something you think that they should be aware of. And again, I'm going to point out here that you'll probably get into trouble with lots of institutions for saying this. Pharma won't like that you're saying this. You're used to causing trouble. You're completely aware of that. What you're going to try and educate reform supporters, people at that conference at the weekend too, is people will say that you're trying to sow mistrust into the system. You'll say that you're trying to open people's eyes to it and make them aware. But health is really tricky, isn't it? Health's a really, really emotive, personal area to lots of people.
Yes.
And you'll have to be careful with what you say. And obviously that'll be down to the people who interpret it and the supporters of reform who interpret it, who quite like a conspiracy theory. They quite like being told, you've been in the dark for 15 years, now I'm going to open your eyes. And they'll go, yes, I knew the whole thing was a con. I knew my parent died because they were given the wrong dose. I knew the COVID vaccine was bad for me. How do you answer those questions that actually you are feeding people who are looking for those stories, not who are approaching them with an open mind?
I mean, that's going to happen inevitably anyway, Kate. We can't control what people think. My job as a doctor is to try and make sure that we optimize outcomes for patients, for society, for the NHS. And what I do is also always make sure I stick to the evidence and cite reputable sources. The system is under corruption of commercial influence, right? This isn't pointing fingers at individuals. This is a system failure.
You do sound like a MAGA supporter. Obviously, you're working over in the United States. That is something I don't know that you would have said 15 years ago. Am I right in your personal journey there?
So what's really interesting, and you can look this up, I have written 19 op-eds for The Guardian and The Observer newspaper. All of this advocacy and what I'm saying, it hasn't changed, actually started with the BBC and The Guardian. So does that sound like, are they MAGA supporters, Kate?
No.
There you go. And you can look at that. And the thing,
I've
been consistent, you see, to that message. I haven't changed. But everybody else, not everybody else, but I think that, what's interesting has been the shift. I mean, I wouldn't have thought, certainly Kennedy is a traditional left Democrat, but I think that what's happened during the pandemic, in many ways, has been good because it's opened people's eyes to problems in the system. And ultimately, everybody wants the truth. I don't think this is about politics so much. I think it's about a realization during the pandemic that we had been misled, things could have been done better. And the question is, how can we identify the problem, the root cause, which is what I'm here to do, and offer meaningful solutions moving forward as well.
Let's talk about what else you might expand upon. We've seen what's happening in the United States with vaccines, stepping away from a vaccine mandate in Florida, including mandated vaccination of children, the announcement to cut funding to mRNA vaccines like the COVID jab. That is the proposal from Robert F. Kennedy Jr. What are you going to be telling the conference about vaccines? Because this is a hot topic at the moment.
Yeah, it is. So interestingly, my connection with Robert Kennedy Jr. started after I published a peer-reviewed research paper in the Journal of Insulin Resistance at the end of 2022, where I actually called for a moratorium on the COVID mRNA vaccines. And that's how we started a conversation. He read my paper. I think I'd gone on GB News to talk about it, and he called me literally straight after.
Can I ask you what your problem is? And I'm going to ask you to just explain this as simply as you can. What is your issue with the COVID mRNA vaccine?
I'm glad you asked it. Very simple. I'm not going to overcomplicate stuff. All you need to do is go back to ground zero. So do you remember at the beginning we talked about the fact that there's this commercial influence over medical research? Historically, there have been occasions where independent researchers have been able to reanalyze some of that data. This actually happened with the COVID mRNA vaccines. Published in the journal Vaccine, summer of 2022, going back to the beginning. So these are the trials done by Moderna and Pfizer. And they were reanalyzed by very eminent scientists, including the associate editor of the British Medical Journal, Peter Doshi. And what did they find when you go back to the beginning? This is what led to the approval. Coercion, unfortunately, mandates for many people, is that you were 2 to 4 times more likely to suffer serious adverse effect from the COVID mRNA vaccine. That means disability, life-changing event, or hospitalization, okay, than you were to be hospitalized with COVID. And this is interesting, this is important, Kate, because recently this has been probably the most important bit of research that has been used in the United States for Robert Kennedy Jr. and HHS saying that we're not going to invest, we're going to ban the investment in this technology. What that means, and this is for me, and there's lots of other data, I'm not going to bore you with it, but when we start from the beginning, it does give the suggestion, Kate, and I'm sure eventually this will come out. I've got a strong conviction on this because I've looked at this data in detail and managed patients and looked at all the different bits of information coming out. it probably, if we'd had an independent review of the data at the beginning, as in the MHLRA that gets 86% of its funding from pharma, which is a problem, and of course it was a rush. We can understand why it happened. It probably may not have been given to a single human being in the first place because it was going to do more harm than good. Kennedy knows that. People inside HHS know that. People inside the White House know that. I've had conversations with them. And the biggest problem we've got now is, and this is, quoting Marty McCarry, head of the FDA, in America, hundreds of thousands of people have claimed they've been vaccine injured. Historically, I had to do months of research into this and also make a U-turn. I must mention this. It wasn't easy for me to do that. I was in February 2021, I was on Good Morning Britain, having had 2 doses of the Pfizer vaccine, encouraging high-risk people, elderly, people from baby community to take it. So for me to change my mind was not easy. But once I looked at it, I was like, okay, there's a problem here. And because of my history in looking at the whole issue of Big Pharma and calling for inquiries through the Daily Mail, through the Guardian, through the newspaper, going to the European Parliament, way before the pandemic, the penny dropped for me. I was like, we've been here before. So what that means is that it is highly likely, well, certainly here, and this is accurate, you can look this up. When I did my research, the MHRA itself published, we have a yellow card scheme in this country. And certainly by mid-2022, by the end of 2021, there were 500,000 reports on the yellow card scheme of what, I'm not saying serious, we don't know how many were serious, but more than mild adverse effects that were reported. Now, when you break down the serious adverse events, you look at America, hundreds of thousands of people thought they've been seriously vaccine injured. The traditional, and this comes from the UK, these are scientists in the UK who have published on this. They said that essentially what is reported is usually an underestimate of serious adverse effects by 10-fold. So we are likely dealing with millions of people, that have been vaccine injured. So that's an issue, certainly in the US and probably here. But the other issue, Kate, and this is going to come out in my talk, is that we've now got concerns, because I speak with people behind the scenes in America of what's going on. It's almost a moot point about the COVID vaccine in terms of getting it banned. And we've got, a petition. This country with hundreds of doctors have signed around the world, thousands of people calling for moratorium. So it's not just me on my own. The issue is this, and I bring this personally as well, is that there is evidence now, hundreds of studies done that show harms of the mRNA vaccines, that there are probably people, and it's not to scare people, and we have to identify how to deal with this. There are many people who are probably asymptomatic right now, who are going around, who are in unnecessary increased risk of, say, heart disease and heart attacks, okay, because of the mRNA vaccine, and also cancer. Angus Dalgleish is this country's probably most eminent oncologist at St. George's Hospital. I spoke to him just before I came here, and I've been working with him, and he's been public about this already. And he said to me, Aseem, one of my greatest concerns is we know now from studies there are at least 13 different mechanisms of how the COVID mRNA jab can cause cancer. So, Kate, I've had this. I'm worried. I've had very high intensity tests done that show that I'm even at increased risk, and I follow my advice. I'm the guy that is,
This is what we're going to. I think I need to jump in here and
this is
say,
what we're going to have to deal with.
And say, this sounds scary. You sound very certain about it. It sounds scary. Yeah. But we need to add some context into here, right?
Yes.
Large swathes of the scientific community do not agree with you. Billions and billions of COVID vaccinations have now been given out. They've been given out by national health authorities, local health authorities, scientists, doctors. They've been peer-reviewed. They've been studied all over the world. And there is, for the mRNA vaccine, an acceptance that it can cause inflammation of the heart in a very small number of cases, okay? Teenage boys is one particular case. They can be particularly vulnerable to myocarditis, which is inflammation of the heart muscle, as you well know, which can be treated. But the point that needs to be made here time and time again, which was made when we had the vaccine as well, is that it's a case of lives saved versus lives lost as a result of taking the vaccine. Yes, it's not foolproof. Yes, there are side effects. Yes, people are affected. But when you talk about the number of lives saved through that vaccine, that completely dwarfs, this is the reasoning, that completely dwarfs any doubt about the vaccine itself. And if you are one of those very, very unlucky people who develop side effects as a result of taking the vaccine, then it is treatable. Okay, and I'm talking very, very small. So I think the issue with what you're saying, and you're obviously very, very, very strong in your belief on this, is that it's not the popular belief. I understand you feel that you're trying to educate people. We know what's going on in the United States, but it will in turn feed into people who are looking for, yes, I knew I shouldn't trust that. I knew I shouldn't trust a max vaccination program. But it would also cause fear in some people as well. Are you aware that when you're saying this, not only are you turning people off the COVID vaccine, you're also likely turning people off all vaccines?
No, so first of all, to answer the second point, the distrust in the vaccines, I wrote about this saying I was very concerned because the establishment has not come forward and held its hands up and said, we've got this very, very wrong. That there's been a distrust.
Why haven't they come forward and said that? Because the whole scientific community, the vast amount of them disagrees with what you're saying.
Corporate capture.
Right.
You said the vast majority, they have become increasingly silent. We have thousands of doctors around the world who are very, very upset and angry and can't believe what's going on. I have doctors constantly calling me, Kate, I'll be very honest with you, I won't name them, eminent doctors saying, thank you, Aseem, for what you're doing. I'm too frightened to speak. What does that mean? What does that describe? It describes a tyranny. Okay, tyranny emerges when people are afraid to say what they think. And when you have something to say, silence is a lie. Or when everybody lies all the time, the tyranny is complete. This is what we're dealing with. This is not a conspiracy. This is someone talking to someone who's been heavily involved in this for well over a decade, who has gone to Parliament, who spoke to chairs of health select committees, spoken to politicians, and in good faith, and has come back and more often than not thought this person, and they've admitted it, they think this is too big to take on. Now, to answer your question about the consensus of opinion, it's very interesting. I come back to John Ioannidis, so no one can dispute the fact that he's the most cited medical researcher in the world. And he did a publication saying why most published research findings are false. And he says the greater the financial interest in a given field, the more likely the research findings are to be, untrue. So what you're talking about, this so-called consensus, I think is a combination of willful blindness and groupthink. And the barriers to the truth, I've noticed as I found this because I've been around the world where I've gone into audiences where you've got doctors who are completely on one side. I went and spoke in Perth, Australia to about 2,500 people. And I remember people were messaging me before I came there because there was obviously a core group of people that were already on side. But there were nurses and that kind of thing who were bringing other family members, other doctors on who were reluctant, saying, we're not going to come listen to this anti-vaxxer. No, and they forced them to come. There were people in tears at the end of it. There were people coming to me saying, I'm so, so sorry. Because when you sit and listen, and this is what's going to come out in the conference, when the facts are presented in a clear, evidence-based way, the penny drops for most people. But most people are refusing to listen. Okay, I'm very happy to talk with Chris Whitty and to all these other people criticizing me and sit down.
But they can only base their opinion.
They won't have a conversation.
And they can only base your opinion on the facts you're giving them. And we have to put that... We have to put that caveat in.
Yes.
It's exactly for those people who advocate for the vaccine, but they will argue that their thoughts, experiences, data is backed up by now billions of COVID vaccines which have been issued around the world.
But that's how I'm saying it's a problem. We've got a massive healthcare crisis. We've had an issue for the last... All countries that are heavily vaccinated have had excess death rates in the region of 5 to 10% per year since the vaccine's been rolled out. We've got, and you know this, you've heard this, we've got people having turbo cancers at younger ages. I mean, I've had so many anecdotes. I'm sure you probably know people as well. This has to be explained, and we've got a mechanism. We've got a mechanism through published, but it's been researched.
But you're jumping from...
I'm not jumping.
You're jumping from one to the other.
The chief medical officer...
The danger is here, Aseem, is that you're going to scare people away from vaccines.
It's not, listen, first of all, I'm glad you mentioned this. This is the issue. This is how I got blindsided. Vaccines are indoctrinated in us, and this
a vaccine's good or bad? Just straight up. A vaccine's good or bad?
Safe and effective, right? I still believe
vaccines are safe and effective.
Listen, of all the medical interventions, I said this on Good Morning Britain, I'll say it again, okay? Prior to the pandemic, the third most common cause of death after heart disease and cancer is prescribed, this doesn't include vaccines, are prescribed medications, okay? Because of side effects, usually avoidable, in large part because of the drug industry sponsored trials exaggerate the safety and benefits, okay? This doesn't include vaccines. And when I went on Good Morning Britain in February 2021 to tackle vaccine hesitancy, I said, listen, nothing is completely safe and effective, right? I mean, maybe more effective, but nothing's completely safe. When it comes to traditional vaccines, from the data I've seen, I still believe that they are actually amongst the safest of all medical interventions.
So those are non-mRNA vaccines.
Yes, but this mRNA technology is more like a gene therapy. It's not like traditional vaccines. And this is the thing that caught us out. When you get injected with a traditional vaccine, you get basically an antigen, a part of the virus or bacteria, a small part, and your body amounts immune response, and then it remembers it, and therefore you're protected. What's happened here is that this new technology, unfortunately, the platform, distributed the spike protein to all organ systems. And even the WHO came out with a list of potential adverse effects, and every organ system is affected, Kate. And now, this happened very recently, Yale researchers were shocked to find 700 days, more than sort of around 2 years after having the mRNA vaccine, there were people who've got some of these long COVID symptoms,
so
who've got spike protein still circulating.
Okay, people are better off getting COVID than they are taking the vaccine. Just to be really clear, and I want a really simple answer because I do need to move on.
COVID is no longer, for the overwhelming majority of people, it's not a deadly disease right now. And I think
even though 200 people a week are still dying from it in the United States and in Europe.
Well, I have to look at that data, and you have to see, are they dying? Is it with COVID or off COVID? Because there was a misrepresentation of the data of that.
But let's just address
people having
the
car
fact.
accidents
and
going as a COVID death because they tested positive for COVID.
Equally, people are getting a COVID vaccine
sure.
and dying of something else, and they're
I
blaming
think
the COVID
it's a wrong
vaccine
question.
for
It's
it.
not about either or. The vaccine itself, in my view, is the COVID mRNA technology is almost for everybody going to be more harmful than beneficial. I can present and show you data on that. We're not going to bore you with that right now. But the issue about COVID is how do we, and this is another issue, in 2020, I was asked by Matt Hancock to talk about what are the links between COVID and obesity. What we need to do is actually go back to how do we make sure that we optimize people's immune systems? And that also comes back to lifestyle. There is alternatives, Kate. That's all I'm saying.
Will it be, or will you be encouraging it to be official reform policy, should they form the next government, to drop mRNA vaccines?
Well, I think it's going to be a no-brainer anyway because of what's happening in America and around the world. I think what reform should be doing now is how do we improve the whole healthcare system? Those issues around obesity, about the food environment, about the social determinants of health, right? These are the major issues that we need to think about. And
But just to be clear,
yes,
that is something we've heard it in Florida, in the United States. Okay, no more funding for mRNA vaccines. Florida, the state of Florida, is dropping all vaccine mandates completely, including for children. Is that something that you'll be advocating for at the reform conference? Yes or no? Because we're tight on time.
I'm not talking about that. But in this country, we don't mandate any vaccines unless you're in an exposed job. And actually, because we use persuasion in this country, which I think is a good thing, not coercion, we actually have better uptake. So one of the reasons in America they have a low tradition before even the pandemic, I think their figures, I can't give you the exact figures, but their uptake of childhood vaccines is much lower because there was almost like this sort of pressure. Whereas in this country, we use persuasion.
Well, our childhood rates of vaccination are dropping. They're now at their worst rate
and
in
that's
15
because,
years.
and do you know why? It's nothing to do with people being anti-vax about the COVID mRNA. And let's not misrepresent this information. This has happened because of the disastrous coercion, and even, Chris Whitty talked about mandating vaccines for healthcare workers, and he pushed it and pushed it and pushed it. And then the COVID inquiry, he came out and said this was a political decision. He didn't agree with it.
Okay, but let's get back to...
No, but where's the credibility there, though?
Okay, but let's get back to why our childhood vaccination rates are falling.
Kate, the medical establishment, the trust has been undermined by what is the handling of the COVID pandemic. Those are the people behind the decrease in trust.
Okay, so you think the way the COVID pandemic was handled is the cause of low childhood uptake in vaccination, not concerns about the vaccine?
No, I think the mRNA vaccine, because so many people have been injured and damaged by it in a way that was never there with traditional vaccines, I think it's undermined the whole process. And because there hasn't been a moratorium, there hasn't been, we got this wrong, guys, or even say, listen, we are really sorry that people got vaccine injured.
But by speaking out about this, people are just going to hear vaccines are bad. Forget about the mRNA aspect of it. I don't think people are, when people are filtering things out, people are likely to may think, I'm being told not to trust vaccines. And you will play your part in that, and you'll be aware of that responsibility.
What I would say is that as doctors, we are taught, if you make a mistake, right, the way to deal with it, an error, and this is I don't think we do this very well, is that first and foremost, you need to acknowledge the mistake to the patient, And the second thing is, and patients will trust you as long as they know your intentions are pure. One, you acknowledge the mistake. Two, you tell them that you're going to ensure that this never happens again, and checks and balances are going to be implemented to protect other people from being harmed. There's a lot of literature on this. This hasn't happened yet with the COVID mRNA vaccine, Kate. And until it does, we won't be able to restore trust. That is the root of the problem.
Well, hang on, because surely more research needs to be done into the mRNA vaccine. That is why funding has stopped for it in the United States. You're putting a big question mark over it, but surely we need to appreciate that perhaps higher levels of research. Well, we need to see peer-reviewed journals. We need to see reputable, and I don't want to come back to this. We can't trust anyone because everyone's linked to big pharma. No,
it's about healthy skepticism. It's not about you can't trust them.
Okay.
There's going to be truth and error in everything.
Right,
the question is what is going to be. The question is we want independent evaluation ultimately.
Right. Okay.
That's what we need.
So we need that. Let me ask you some quick questions.
And that's what I'm going to suggest as well in the Reform Conference.
Okay. Let me ask you some quick questions. Donald Trump's health. What's happening with it?
Listen, as far as I'm concerned, I don't know. I'm not aware of him having. I'm not aware that he's got any major issues. Certainly, it's interesting that during COVID, I was asked by Sky News to talk about the fact when he got COVID, what was going to happen to him. And I saw his medical reports, certainly from a cardiovascular perspective, and I think they've been updated recently. He doesn't have, he's actually very healthy from a cardiovascular perspective. He doesn't have any degree of heart disease. He's taking some cholesterol-lowering pills. I don't necessarily think that that's, probably going to be, do more benefit than, it's going to be beneficial for him. But as far as I'm concerned, I'm not aware of any major issue.
What is your role with MAHA, with the Make America Healthy Again Institute? Let's just call it that.
So I'm a medical advisor to MAHA Action, linked to the Institute, which is essentially a grassroots organization that is there to look at research, education, and legislation when it comes to what can be done to make America healthy again. My initial role was potentially to be, I know Bobby Kennedy wanted me to be in HHS, to be a medical officer, maybe his chief medical officer there. But because of the America First policy, the White House came back and said no foreigners. So this.
So you couldn't work directly within Trump's administration, but you're working for MAHA, which is
peripheral,
officially,
peripheral.
Yeah.
But I have personal relationships with Bobby Kennedy. I have a very good relationship with Jay Bhattacharya, who's the director of the NIH. I'm in regular communication with them, and several months even before all of this, going back the last 6 to 9 months, they have received and asked for specific information from me about how we make America healthy again, and I've given them that.
Have you had any dealings with the current UK government?
Unfortunately not.
And when they were...
I would like to. I would be very happy to speak with Wes Streeting.
And when they were in opposition?
When they were in opposition, yes. In fact, it was Tom Watson, who was a deputy leader of the Labour Party, who attributed his losing 100 pounds and sorting his lifestyle out to reading my book, The Pioppy Diet, and then, me advising. Keith Vaz, when he was a minister, invited me to speak. And of course, the sugar campaign stuff was essentially, through Labour, and Jeremy Hunt. I had meetings with him, and obviously I was considered the lead campaigner behind the sugar drinks tax. So I have had...
what do you think the current UK government thinks about, or would think about your views?
I don't know what they would think, but, what I found, Kate, in my experience, and this is through my lectures and through my writing, is that when people actually sit and listen, they are very receptive. And there are many politicians, from Andy Burnham, who I have a very good friendship with. I've known him for many, many years, Mayor of Manchester. Tom Watson, who I spoke to even a couple of weeks ago. Even people in the opposition, Priti Patel, for example. David Davis. There's so many MPs that they sit and listen to me.
Are they agreeing with you on the mRNA vaccines?
Many of them, I won't name them, many of them come to me for medical advice.
Yeah.
So
Are they agreeing with you on your concern about the mRNA vaccines?
They have not said anything that disagrees with me. They've heard me out and they've not contradicted me.
So people close to this government are listening to you about what you have to say, your skepticism about the research and the validity and the safety of mRNA vaccines.
Yeah, but Kate, this goes back. It's not just recent, right? When they look back and they see the articles I've written, front page commentaries for the Observer, for example, on this very issue.
But they'll also have the opposite view to hand as well, and they'll look at the lives saved, won't they?
Yeah. So that lives saved thing, by the way, I know the problem with that is that, and I'm going to quote Carl Hennigan here, who's a director of Centre of Evidence-Based Medicine, Oxford. He said that this figure that was quoted of 14 million lives saved, for example, is implausible. Now, in this country, he is probably considered the most respected professor of evidence-based medicine. If he says that, we should look, and where did that come from? It was a modelling study. It was essentially made up. It's almost like saying that we are going to talk about how good Brentford are as a football team and ignore Liverpool. This is what's happening with the research, and the media are amplifying essentially very poor quality research as truth and ignoring much better evidence. So that's how I would explain it, Kate, to try and get your head around it.
Dr. Aseem Malhotra, Thank you for joining us. Appreciate it.
Thank you for having me.